Okay, so we're going to start this final session. Thanks for those who are still here and hanging back for this. Really, this last 3 days has been a lot. I know our brains are, our emotions, our thinking. There's just been so much going on in terms of all that's happening, all the conversations that have gone on. But and we're really looking forward to how we can continue to move this country forward to support a national strategy. So in this last session, it's really for our members, and it's really to cast a vision forward about where we're going as an alliance. We do have a new strategic plan. The last one was pre-COVID, which seems a long time ago to many of us. And we, based on everything that's changed in the landscape, S203, as we've spoken about, S203, as we've spoken about and are celebrating, we have a new strategic plan to help put legs under a national autism strategy to help some of the conversations and the priority issues we've heard in these last 2 days help them come to fruition. So our strategic plan, I'm going to go through our new strategic plan, give you an update about RWA, Ready, Willing, and Able, one of the programs we deliver. And then I'm going to close with some key initiatives that you're going to see come out from the Alliance and its members in the next year and a bit. So our strategic plan, as we've done a bit of consultation over the last year and a half, we've landed on, after input from key members, all our members, some town halls, speaking to government officials, other organizations. This is the space where what we've heard and synthesized that would bring a contribution in Canadian society. So our vision hasn't changed. It's a Canada where autistic people exercise their full rights and realize their full potential. And our mission, what is our mission? How do we do that? Well, our mission is to improve the lives of autistic people in Canada and their loved ones. We do this by bringing our members together, such as today and yesterday and the day before, identifying priority issues, we did that, and developing meaningful ways to address them to inform policy and practice at a national level. So our principles, how do we work together? Well, we want to be able to have reciprocal learning from one another. We all have different things, different ways of knowing about these things to bring to the table. Meaningful inclusion of people with lived experience. How do we add community, or not how, but our principles are to add community to the broader disability community, understanding how this comes together, C22 and other bills in the Canadian context, and understanding how autism fits in. Having equitable representation among leaders in this sector, and also encouraging and welcoming diversity of thought and dialogue. We all may have different ways of thinking, different ways of, and diversity of opinions on different things, but how do we come together on those shared priorities, having a common agenda so we can move forward together? Our process, as we're seeing these last day, how bringing people together, convening the community, catalyzing. So what we mean by this is to help things move forward easier and faster through different mechanisms, working with different people, having different conversations, and also collaborating, making sure we're doing this in partnership with our members, in partnership with others, like-minded individuals who agree and work with the same principles. So our strategic priorities in this new plan can be summed up into 4 pieces, and I will go through each of these in order. So it's going to be a shared policy agenda, accelerate systems and policy research, facilitate collective impact, and advancing operational excellence. So a lot of big words. I'm going to go through this a bit slower, what it means specifically for the Alliance and what impact we think this is going to have over the next few years. So the first one, develop a shared policy agenda. So what this means is a lot of what we've seen today and this week, bringing together key stakeholders to inform common policy goals through the implementation of a national autism strategy. As we're expecting, the national autism strategy will be created, will be developed, and we want to help guide that, make sure it's actually developed, and then helping with the implementation so that's actual impact on the ground for families, for individuals who are living and experiencing the context we have in Canada. So the impact of this is a more inclusive Canada through policy that captures diverse perspectives of autistic people in Canada and their loved ones. And we use the term autistic people in Canada, realizing it's not just Canadians. There are many people who are autistic in Canada that are not Canadians. So some examples over the last 2 years, when COVID happened, many of you were part of online working groups as we had a policy. We developed 2 years of 2 years of policy work that generated a policy compendium looking at sort of concrete actions to move different issues forward based on the blueprint that we had before, and also on the key pillars from the federal government's guidance of social inclusion, economic inclusion, and diagnosis and supports. So we gathered leaders in each of these areas and try to say, okay, what are the concrete key leverage points in policy that we can do, knowing what's happening at the grassroots level. You can find that online on our website. The International Autism Policy Initiative. So yesterday, if you were here, you saw a few of the policy experts from around the world, from Malta, from Autism Europe, and from the US. And there are a few others who've been working with us. We're trying to have, understand better what's going on internationally. How can we learn from them? How can they learn from us? That reciprocal learning, and continue to be a leader in the field from Canada. And I believe it was Yvonne who said really well, that others can learn from us, even though we're on this journey ourselves trying to move forward. And lastly, on this slide, Bill S-203. So this is just one example, a shared policy agenda. Many of our members here testified as when this bill was going through the Senate to tell about their experience, tell about Indigenous community experience, and how S-203 could be better improved. And all our recommendations from members of the Alliance and others were taken into consideration by the Senate committee. The second one, accelerate systems and policy research. We mean accelerate because we know that research does occur, but we think there's a way to help it move faster, and we want to encourage that. So what this means, autism systems and policy research in priority areas. So some of these areas we spoke about, wait lists, looking at collecting data the same way, looking at surveillance and what that means. How do we get the same numbers? Why are numbers different? Well, we're counting from different systems. Is it social services? Is it health? How do we help bring some continuity or some harmonization of the numbers, not just the numbers, but other pieces of data we need to collect across the country? And it's really by leveraging a broader network to build a research network, the broader network of researchers, a broader network outside of the people in this room. And we're planning to set up a scientific advisory of that to help guide some of this work forward. And it's increasing the capacity of diverse autism-focused researchers. So, and research can be done in different ways with different approaches, and we want to embrace them all, realizing there's not a one-size-fits-all scientific method that works for different forms of knowing. So the impact of this would be Canadian evidence that's co-generated by autistic people. We want to have a national lived experience advisory that will guide this work, and it'll be co-designed with that. And I'll speak about that a little later. And we want research that is excellent and that's useful. Both, we want relevance and rigor when we present the work we're doing forward. And also a workforce of neurodivergent trainees. One thing where we want to build in this country, and we talked about that, the days that we're going to have autistic MPs and senators in the political and policy sphere, but also in research, making sure research is autistic led with autistic researchers, et cetera, and helping build that pipeline. So some of the initiatives, and I'll go into some of these in detail later, but a waitlist initiative that I'm really pleased to announce that's going to take place over the next few years. Policy forums, we heard a bit about the provincial, territorial, and how do we bring folks together across these silos, across the different districts, and how do we hold these and have a common understanding of data around them. We have a Canadian Autistic Adult Needs Assessment Survey, which the minister announced, and I'll get into a little bit of detail around that as well, and the Lived Experience Advisory Group. Facilitate collective impact. So what does this one mean? Well, we want to convene people from multiple sectors to solve real world problems. Housing, if you were here on Monday, seems a long time ago already. But bringing together different people, different leaders who we're all trying to bring together people to learn from one another. The Accessibility Institute, Sydney Family Foundation on the housing, and post-secondary different researchers who are doing that to solve real-world problems of different campuses, learning from U.S. counterparts and others around the world. And it's advancing the progress on member identified priorities. So these, why did we pick these? Well, as we're talking to our different members, as we got feedback from the past two summits when things were virtual, these were some of the key topics that kind of came up. So the what you wrote on chart paper, that is not ignored. We have to take individual pictures of each of those, put it in a Google folder and bring it home to analyze and try to understand out of the thousands of post-it notes. So thank you for that exercise. We're going to do one more of those, but it's very valuable to help determine these priority issues, what we need to work on next. And really, the impact overall, we want to transform the social and economic landscape for autistic Canadians and their families. So here are some examples. The summit, facilitating collective impact, bringing people together. We're part of a pan-Canadian disability coalition. So not just within autism, but looking outside, how can the rest of the disability community learn from what we've done in the autism community? And how do we work with them to make sure things like the Disability Inclusion Action Plan and the National Autism Strategy and other disability initiatives are moving in tandem and not siloed, because this tends to happen if we're not focusing on bringing things together. And we're leading some of the projects around that. The Canadian Journal of Autism Equity, which we launched three years ago, I believe, and continuing that work to allow for autistic voices to be in those policy discussions, talking about specific issues. And if you weren't here on Monday, their next issue is going to be on housing. So they're looking for submissions about stories and experiences on housing. So please feel free to contact us and we can point you in the right direction on that. And Ready, Willing, Able, our partnership that we have with Inclusion Canada on employment. This is just a slide of our I don't think it's exhaustive, but some of our current collaborators, partners, and funders on some of these projects. So appreciate all the work that's going on. Again, it's not exhaustive, so I apologize if you're not on this list right here, but there's many more that we're working with to kind of allow for collective action to take place. And lastly, advancing operational excellence. Everybody's been saying, "Oh, it's been great," and really, we're a really small group. There's not many of us, and we're piecing it together as we go. I was the first staff member, if people didn't know, and I came on right before the pandemic when the government gave us some funding, and slowly we're trying to build and trying to continue the good work that has happened. And really pleased to see how we're continuing to grow and find our space as a small organization. But we want to continue to empower organizations to fulfill our mission and priorities. One of our commitments is to make sure our organization, our staff are just as diverse. And we sort of have commitments internally to say, make sure we have neurodivergent employees across the spectrum and other conditions involved in our organization. So those are the four pillars of our strategic plan. There's going to be more details. There's going to be copies outside if anybody wants to take a copy after this session. I'm going to go on to give an update about Ready, Willing, and Able. This is a program that we deliver in partnership with Inclusion Canada. So we have been delivering this since 2014, and we're in the third phase, which we just received funding for. It's a project to help and support employment, and many of the organizations in this room are the local delivery partners in over 20 communities. So we're trying to aim for 30 in this phase 3 expansion of Ready, Willing, and Able. And here are the partners that are there. And I don't know if Frank is still in the room, but I just want to give a shout out to him. He's not here. Okay. So so they're one of the Frank is the assistant national director of the program, and I'm sure many of you have interacted with him over a little bit. So in this last phase, these are some of the highlights that I'd love to share here. We had an Inclusion at Work webinar series. It's a 3-part webinar about practical applied strategies to support inclusive hiring. And really was looking at tangible strategies, ways to network with others and to create inclusive workplaces. We also launched Employer Forum series with RWA, and this was a 4-part webinar series last year looking at the impacts and implications of inclusive employment, especially in a post-COVID time when things were hybrid or online. How do we navigate this as a country? We had about 370 participants, different employer groups and agencies that were involved in this webinar series. And these are just some of the programs and the knowledge hub pieces above and beyond the regular delivery of programs. But the program itself is being expanded, and the phase 3 targets are there. So just to give you a sense of the scope and the size and what we're trying to aim for in this third phase, we're going to try to reach 10,000 employers across the country. And out of those 10,000, 2,000 employment outcomes to see if we can get somebody hired, an autistic individual with intellectual disability. And there's going to be 10 partnerships with national employers established. So we're looking at national big corporations to work with them specifically because they can kind of scale the work internally in their own organization across the country. And then specifically looking at BIPOC populations, partnerships, 6 new partnerships established with Indigenous or culturally specific communities. And here's a map of where we are, where the Ready, Willing, and Able program is. So you can appreciate we're trying to be as pan-Canadian as possible. So I talked about the strategic plan. I've talked about Ready, Willing, Able. And lastly, what I want to talk about before we go into member discussions is our brand. So this is a sneak peek of our new brand that's going to be coming forward. Our name is Autism Alliance of Canada. We did that name change from CASDA over the past year, recognizing sort of a strengths-based approach and taking the term ASD, Autism Spectrum Disorder, out of our name, reflecting what we believe and value. And we sort of we kind of kept the same logo at that point as we were going through this rebranding. And if this works, so we kept that same logo and we wanted to give it a much more of a Canadian flavor. And this is the first look at our new logo. There we are. So Autism Alliance of Canada, same name, different logo, representing the same flavor we're trying to do. We have a new set of colors and we will have a new website coming out in the next little bit. So last part of my presentation, coming up at the Alliance, I'm going to talk about really briefly a few of these projects that are going to be coming up in the next year and a bit, as we're trying to help help with the implementation, help with moving a national strategy forward. So these are the 5 I'm going to go through quickly. So, we want to advise research and a policy at a national level. What does that mean? Well, we want to engage diverse participants with lived experience and have that as a mechanism and provide resources for safe and respectful engagement. We know that in a lot of times research engagement can cause harm to people. It's happened in the past. We hear that from our Indigenous communities, but not just that, in many settings. So we want to find and work slowly and systematically to understand the best practices in engaging in such a big way across the country. So with support from the CNE Family Foundation, we do have a CHR patient-oriented research grant that was awarded to us. It was actually first in the competition to build and support this advisory. And we're gonna action this over the next 2 years. This project will be led by a data policy fellow. I don't know if they're in the room right now, but I can't see so that far. But so one of our policy fellows will be leading this project with funding from CNEV and the CHR, the Canadian Institutes of Health Research. So we're going to be launching this opportunity in the summer, and there's going to be a bit of a recruitment process for different people to be involved for this committee. And this is an example of what can be achieved with all our members and their support. We hope that this can be a mechanism for continuous and meaningful engagement of autistic people and their caregivers, their families, in research and policy that will directly impact their lives. So stay tuned for opportunities to apply for this. This is for people with lived and living experience on the spectrum. So the next initiative, 2 out of 5. This one is looking at policy forums with the PT government. So we heard a bit about this morning, the sense of needing some uh, collaboration, alignment, having provincial action plans, framework strategies, and territorial strategies at that level. So when a national autism strategy is developed, it doesn't get stuck there, right? We want to make sure the supports and services by the provinces are it flows from the federal level, and there's some alignment there. So this is really to bring them together. It's a knowledge sharing mechanism to align federal and PT priorities. The idea is to convene them and help develop action plans that there's impact. And it's going to be an ongoing thing as the strategy is implemented, as we can monitor what's happening, initiative that we're going to be starting and hopefully continuing over the next couple of years. And lastly, if you over the last few years, we started a data collaborative, and there's a wide membership that was involved in that. And we're going to have another engagement event on June 19th. And just to hear the progress, we had feedback from members during that time about what are the priority issues, what are the issues around different data sources. We looked at administrative data, waitlist data, et cetera. People did the stickies online at that time, and we came up and with 5 projects that actually are concrete projects that we have brilliant PhD and postdoc fellows working on, and they're going to give an update about that. And yeah, the Eventbrite is up there. If you want to take a look, you can register for that and just hear an update about that. And this one, so this is the National Autism Waitlist Initiative. So this is big, and we're starting small. We're trying to measure autism diagnosis waitlist times across the country. We know that without a number, we can't change things, and we can't measure what we change. So this is our first, and we're starting at the level of diagnosis. So we're partnering with Dr. Melanie Penner at Holland Bloorview, and developmental clinics across the country in Ontario, Nova Scotia, Alberta, Manitoba, and in BC. And this is an exciting initiative that was developed out of the ADC, the Autism Data Collaborative I just spoke about. We know that it's been up to 2 years for many of our many provinces, and our members want to do something about it, and that's why we're putting this together. This initiative is going to collect waitlist data from across these provinces, these clinics across the country, and ultimately the goal is to generate a waitlist dashboard, and it's going to be used to inform national level policy to reduce waitlists for diagnosis and improve health equity. And we're hoping to scale this. It's also being co-funded by CAHR, and we're going to try to continue to apply for grants to keep this moving forward. And this, I just want to pause and say, this is a demonstration of a power of the Alliance, right? This was not just me. This was not Deepa. This was not one of us. It took multiple clinics, multiple people. It took the community at that ADC event say, hey, this is a priority issue in my area. We saw that theme come up a few times, not just a few, many times. And here we are. We got a bit of seed funding to try to get this started. So we're hoping it'll build some momentum. We're hoping it will put some legs under parts of the strategy, help with the monitoring, help with the data collection to move policy forward. So a great example of what a network can do like this. It's a coalition of the willing, and we're looking forward. So if you know of a clinic in your area that might be interested in participating, please email us research@autismalliance.ca, research@autismalliance.ca. And also, if you have lived experience or are interested in this project, attend that ADC event I spoke about 2 slides back, June 19th, and there'll be an opportunity to join and be a part of this project. And these slides will be given to you afterwards. So if I'm going too fast, feel free. I know I'm trying to make sure you guys can get out in time. Lastly, so these are just some examples, so much about data we spoke about today to inform how we move forward. Here's some surveys that I want to tell you that are coming up. So the first one announced by the health minister this morning. So in collaboration with Master University, we're launching a Canadian autistic needs assessment survey funded by the Public Health Agency of Canada and in partnership with Cindy Family Foundation. And this survey is going to gather the experience of autistic adults to ultimately prioritize, address the needs and their priorities in research and policy. And that's going to be coming up very soon. You'll see that in our newsletter in the next couple of weeks, probably next week. And Mackenzie Salt, I believe, who's in the room, can put up his hand. He's the lead researcher on that project. The next project here, another project we're working collaboration with Autism Speaks Canada and McMaster University. It's a follow-up to the pandemic needs assessment survey we did when the pandemic started. This is sort of a follow-up after that, the pandemic Canadian autism needs assessments. And it's really to understand the impacts of COVID-19 on autistic Canadians and their caregivers. So in this one, we are going to look at how the COVID pandemic has evolved across the country and how it's impacting people now versus what it was in 2020. And this is going to come out later in the fall. And this last one is a smaller project, and we always think about equity in all what we do, because when we don't have equity in the picture, we lose it and we move on, right? So this is one project that we're working with McGill University, looking at the needs of primarily caregivers of children, but also their parents likely, who don't speak the majority language, so minority language speakers. So for example, if you're in Alberta and you speak French, or if you're in Quebec and you speak English. So when you're speaking the minority language, that's out of the official languages, but also if you speak other languages, immigrants, for example, in our provinces and territories. So this project is looking at the barriers to care for minority language children on the spectrum. So this work is really to understand the barriers and just to get a better framework around what their specific needs are in the community. We know that there are, we're already having trouble if you speak the majority language. So imagine what it is like navigating a system when you don't speak the language. Okay, just to recap, so those are just a flavor of some of the work we're looking forward to launching and doing over the next few years under this new strategic plan that we have. And to the close, so if you want to get involved and if you're not a member, do become a member. The benefits really is being part of this conversation yearly, and not just yearly, hopefully more often. And we have a bi-weekly newsletter. It gives updates about what's going on in our community. Members can contribute to that newsletter with their own initiatives. So we're really excited to continue to learn, reciprocal learning with one another, advocate with a strong, collaborative, unified voice, participate in working groups, community practices, the Autism Data Collaborative being one of them. Learn about unique training opportunities. We're trying to build capacity with neurodiverse students, et cetera. And just being involved. We know there's been a lot of action over the last 2 years with the National Autism Strategy, and there's going to be more work to be done. So looking forward to you being a part of this. As of today, we're actually over 700 members and counting. So we have associate members over 450, community members over 150, and organizations over 100 of them. So I'm really glad, really honored to be myself personally part of this journey as we move forward. Here's just some of the logos of our member organizations. And, most slides I would apologize for if you can't see the font, but this one I'm proud of if you can't see the font, just showing how great, how our membership is growing and all the organizations are there. So again, share your experiences, lead, participate in projects, and really help us bring community needs to the forefront. And this is what it's about. We want to bring community voice. We want to bring the research in. We want to inform policy and become that interface at the Alliance.